It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives. Changing lives. Changing lives for the better. For the better. Changing lives.
Hi again, everyone. I'm Candace Kruger along with Jim Knox, and we're back again with another edition of the Best Docs Network, featuring some of the best physicians in the Houston area that are helping to change people's lives.
That's right, Candace. This is a place to come to find the right doctor. And as Candace said, this is all about doctors helping change people's lives. These are inspirational stories. They're factual, they're real, and you're going to enjoy them. Like our first story with Dr. Paul Metz, oral surgeon, one of the best in the Houston area.
The ideal patients for dental implants are ones that have been through lots of restorative procedures, and where these procedures that just aren't predictable. And so we were able to give them their third set of teeth with the use of dental implants.
I had an accident when I was 10 years old, and I fell down on my face and I dislocated my jaw. And I didn't know that then, but I started looking for the oldest doctor or the one with 35 years or more of experience. So I went to the facility in Gessner and I saw Dr. Metz, and they said, this is the guy who's gonna have to be working on you. I had to decide if I wanted to go through with it, and I did research. He graduated top in the class.
So in Tico, we were able to move his upper jaw forward and set his lower jaw back so as to help line up his skeleton so that his teeth meshed together well. We, as specialists in oral surgery, are uniquely qualified to provide these procedures.
I just figured out this is the best facility, this is the best doctor, and I truly believe that, you know, Dr. Metz and his team, they know what they're doing.
These patients, when they come down the hallway, when we see them after this procedure, we see their level of confidence has gone up tremendously. We can tell by the smile on their face as well as their dress. They're dressed sharply and they're holding their chin up. You can certainly tell that they are happier individuals afterwards. Technology today has, really revolutionized how we practice implant dentistry. We have cone beam CTs, which allow us to take a CT of the patient in the office, and in about 20 seconds, we have 360 degrees of bone around the implant. So we know ahead of time whether we need to graft and also the type of grafting that we need to do ahead of time. So patients are better prepared for the experience and know more of what to expect afterwards. We're able to do this in a safer fashion. And it's much more rapid. The procedures are much more rapid, and the recovery is much easier as well.
12-year-old Kyle loves to play baseball, but it was hard to do due to allergies. That is until he met Dr. Lynn Dickens. To find out more about Kyle's story and other life-changing stories, log on to bestdocsnetwork.com.
The reason why I chose breast augmentation was because my breasts were smaller than all my friends. I had the smallest ones, and it was never fun wearing a swimsuit. And
Megan came to us looking for breast augmentation, and it's a surgery that allows her to fill out her clothes, fill out the fashions that are popular, and have more confidence in herself and her appearance.
When I was trying to figure out the size, I didn't want something that looked fake. I kind of wanted to look natural. And
with the breast augmentation, we'll see someone for an initial consultation, and then after the initial consultation, you'll have a preoperative visit. And the surgery itself, they'll come in that morning, they'll meet with our nurses and our anesthesia staff, and then the surgery itself takes about an hour.
I got the breast augmentation done on Friday, and I returned to work on Tuesday, and I really didn't take the medication as much as I should have, which was fine because the procedure, I I healed pretty quickly.
I think in general, the ability to have an operating room in our office allows us to control the entire experience. And so from the second you walk into the office to the second you leave, and you're seeing your 3rd and 6th month follow-ups, the experience is controlled by myself and Dr. Bancroft. The Quad A SF is the gold standard for outpatient ambulatory surgery centers to be credentialed in and accredited by, and so we have voluntarily have gone ahead and gotten certified. Unlike many other surgeons who do it in an unaccredited or non-accredited facility, you just don't know how safe it is to do it there, and they may be very capable or they may not have all the equipment they need.
I feel a lot more confident in myself. I feel better when I wear clothing. It's more fun to put clothing on.
Patient selection is important, and making sure that your ability to deliver results are in line with their expectation. If their expectations and your expectations are aligned, they're extremely pleased with the surgery and being able to do it in the office in a comfortable environment where they're familiar with the office staff. And so as long as you select the proper patients, then patients are very satisfied with breast augmentation or any of the other surgeries we're able to do in our office.
We're all different. We like different things. But one thing nobody likes is pain, especially when it keeps us from doing the things we love. Luckily, Pam is here. Whether it's back pain, carpal tunnel, foot and ankle pain, or more, PAMA physicians are dedicated to their specialties and dedicated to your quality of life. Don't let pain keep you from doing the things you love. PAMA, pain freedom.
The Best Docs Network is all about doctors that are changing people's lives, like our next doctor, podiatrist Dr. Gabriel Maislos.
I came for the treatment for my toenails most of all, but all my all my toenails were bad, really bad. They were in bad shape and they were discolorated, like some white stuff on them. How to say? They were disattached from the nail bed in one place especially, and was kind of yellowish too.
Ms. Ina Yashova came to my office complaining of fungal toenails. Very common thing, especially, you see it in summertime. It's very prevalent. It's a fungal infection of the nails. The nails are discolored, and she wanted them treated.
I keep my body in shape, and I want to be healthy, and I want to have everything perfect. So it's one of the things. When I found out that something is wrong, I couldn't go for some time because I was busy. But I told to myself, no, I have to.
It's basically a YAG laser, and it creates this intense heat, and it kills fungus, bacteria, virus, and it kills it at the root of the nail. That's where the nail begins. From that point on, we have a protocol in place to prevent reoccurrence, because probably most of the problems that have occurred in the past is even prior to the laser with the oral medication was that you would get rid of the fungal infection and then it would come back. So you also have to do your part to make sure that you don't get a recurrence, because once you're susceptible to fungal infection, you remain susceptible the rest of your life.
I figured out that I have good results because when I could see there my nail growing, the new nail will come pretty and doesn't have anything, like no fungus, nothing, no discoloration. It was pretty and nice and healthy nail.
The risk of a fungal infection is not just the appearance, and so you don't want to wait on it. You want to make sure you come in early because you don't want to go to that severe category where you might require multiple treatments. It's better to treat it early on. Not only that, the nails, when they become fungal, they become yellow, thickened, discolored, hypertrophic, and you can develop ingrown toenails. That's a serious risk because that's an infection, and that requires a surgical procedure.
I got new nail bed, new nail, and it was like pretty healthy.
You hear a lot about low testosterone nowadays. Don't respond to a lot of these things you hear on the radio or on TV or on ads in the newspaper. A lot of it is just a way to produce revenue. Low testosterone is more common than we thought, and it's easy to measure in your doctor's office. And low testosterone can occur as you grow older, or it can occur in young men. What are the symptoms? Well, you can feel tired, your muscle mass may be low, or you may not be able to build muscle mass with exercise as you once were able to. One of the main symptoms is a low libido. Your sex drive gets low. Your interest in sex is not quite what it used to be. If you have those symptoms, you can get your testosterone checked. Testosterone tends to go up and down during the day, so you have to have 2 or 3 points in time, and that means 2 or 3 different blood tests to find out what the average is. The most accurate time to have your testosterone level drawn is 8 to 10 a.m. in the morning. That's when we know exactly what the measure should be. And if you're low, and the other hormones that we check along with it, if they're also low, then going on testosterone replacement will help you. It'll improve your libido, it'll improve your sense of well-being, your muscle mass, and your energy. So check it out, but do it in the right place, your doctor's office.
The symptoms is I had headaches, a lot of congestion, infections in the throat, a lot of mucus in the back, ear headaches, so much stuff going on.
Janice Martinez is a patient who came to my office complaining of nasal obstruction, facial pressure, constant headache. She has been treated under multiple medication, including antibiotics, antihistamine, nasal spray, without really, without any good success.
I went on, but then I started getting infections, and I was on antibiotics for 4 months in a row. They kept giving me, so I was like, this is not good.
So when we examined Miss Janice Martinez, we found that her natural sinus drainage pathway, it's obstructed by chronic inflammation, chronic infection. So we offer her the option of doing balloon sinuplasty.
The best part was the breathing. I could breathe again. The headaches, little by little, started going away. Now when I sleep, I would breathe real loud. My husband will always say that, and I don't do that no more.
So when you have a chronic sinus disease, that passage, it's obstructed, it's narrow by chronic inflammation, chronic infection. So what we do is we put a small balloon in the passage, and we open up, you inflate the balloon and open up the natural passage, preserving the normal anatomy.
And I don't sound like I have cold all the time. Before I was like sick all the time. And now I'm doing great. I could go out, do everything, and I feel good.
One of the advantages is the quick recovery. There's really no downtime to balloon sinuplasty. The procedure can be done in office, under local anesthesia or the topical anesthesia with some nasal spray. There's not really a recovery time for balloon. The patient can go back to her daily activity the next day, and compared to a traditional surgery, which the recovery can last to a week.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com.
I saw the potential in 3D at really taking digital to where we needed it to be, and it really has become what I would call a revolution. And I was very strong in my recommendations to the company that we really focus on looking at this as a screening tool. That's where it was going to make its impact.
2 years ago, I went for my annual mammogram, and was in there, and they told me that they were doing a study for the 3D, and they asked me if I'd like to participate, and I said sure. I was already back there and undressed, and it was not a big deal.
She was the second patient in the multi-center trial that we did in 2010, and you had to come and get your standard 2D digital mammogram, which got read separately, interpreted by a different radiologist, and then the 3D exam would be performed separately.
First, I got the letter that said that no problem, didn't see anything, come back next year. Then I got the phone call, and they said, well, no, we saw something in the 3D. And it turned out that one of the tumors was actually an aggressive, the HER2 had a HER2 marker in it, which is the more aggressive, can be one of the more aggressive cancers.
As we're able to page the breast a millimeter at a time, we're able to look at areas that we would struggle with before on the 2D mammogram and say, is that something or not something? If you find malignancies less than 10 millimeters in size, the prognosis for the patient is essentially the same as the general population. So most of those people, the vast majority of those people, 98%, are cured.
Obviously, somebody up there was looking out for me. I mean, I think it's the greatest thing. I mean, I think it saved my life.
So this woman had received a normal letter for her regular digital mammogram, but on 3D, we were able to find 2 very tiny cancers. That's the value of finding it at this stage, and that's what makes this test the most exciting thing I've seen in my professional career. Don't forget, for more information on any of the great doctors you see on today's program, head to the website, bestdocsnetwork.com. That is bestdocsnetwork.com. Now, Candace, it is time to head to our next best doctor.
It certainly is. Our next doctor is bariatric surgeon, Dr. Robert Marvin.
With a gastric sleeve operation, for example, he's going to lose the majority of the weight in the first year. And he should see quite a bit of benefit in terms of how his joints feel, his ability to bear weight, and the axial loading on his spine.
Before surgery is approved, Paul has to clear several tests. First, a visit with cardiologist Dr. Nasser.
So the purpose of the evaluation is make sure the heart muscle is in good shape, the valves in good shape. So from the cardiovascular standpoint, we do all this to tell Dr. Marvin, the surgeon, that your patient is in good shape and we expect no problems from the cardiovascular standpoint when he goes through surgery.
A comprehensive sleep study was then performed to properly diagnose his sleep apnea.
I wanted to offer the service for Paul because in the situation in which his weight has always been a big person, there are some adverse effects to that, and wanted to diagnose the level of apnea that he may be experiencing so that he could get the proper treatment for whatever needs to happen. We just want to make sure that we diagnose everything and get him where he needs to be.
Paul was now cleared for the surgery that would forever change his life.
Well, good morning. I'm here. It's about 5:30 in the morning. I'm getting ready for my pre-surgery prep, which starts in just a few minutes. My surgery starts at 7:30 a.m. and I've come here. I'm fixing to meet with a doctor in just a few minutes, and I'm very excited. I'm looking forward to this day. We all make decisions where we look back on our lives and say, I'm glad I did that, and I already know in advance this is going to be one of those decisions for me. Look back on my life a few years from now and say, I'm so glad I did this, and I'll always remember this day, October the 25th, 2012, when my life got better for infinitely.
I had 2 children and I nursed them both, and my breasts were completely saggy and gone.
Aisha came to me after she had 2 children. She was interested in improving the appearance of her breast after breastfeeding and childbearing. They had lost some of the fullness, and that typically happens after giving birth.
I simply wanted to go back to the way I looked before I had children. I didn't want to look unnatural in any way, and he completely understood that, and he had a very good understanding of what both me and my husband wanted.
That's the most common question, is can they get that body back after children? They may not necessarily get that exact body, but we certainly can remove the extra skin, tighten up their waist, and give them that figure back that they had before.
The procedure went very well, and the recovery time was easier than I thought. I mean, I thought the tummy tuck, which I almost didn't want to do in the beginning, and I ended up doing, which I'm very happy with, was actually much easier than the breast augmentation. I was probably in bed for about 5 days, and then not really back to myself for about 2 weeks. But 4 to 6 weeks after that, I was completely fine, like nothing had happened. I felt great.
Typically after having children, women have extra skin and some fat along their tummy as well as on their hips. And this is, even with all the exercising, many people can't lose that weight. And so if they've completed their childbearing, that's the perfect candidate. With the breast, many times again, there's postpartum involution of the breast, so many times again, after childbearing, they can't reverse this effect, and again, that's a good candidate.
He was very, very nice. He was very applicable to my needs. You know, he talked both to me and my husband about what kind of results I wanted.
Someone who, like herself, who's very fit and wanted to enhance the appearance of her breast after childbearing, this was a perfect case for her.
And he was so professional and so nice. It was fantastic, fantastic experience.
Best Docs Network is all about doctors helping change people's lives, like our next doctor, OB-GYN, Dr. Meredith Morgan.
What we want to do is try to help a woman get through this time frame with the intense symptomatology.
According to Dr. Meredith Morgan, intervention and management needs to be tailored to the level of severity.
For mild hot flashes, home remedy self-management techniques are effective. For some women, yoga will work. Other women, strenuous exercise. On average, you can't say that either one of them really works for everybody, but if it's good enough for an individual woman, it's good enough, and that's all she needs. There is a technique of breathing that's derived from transcendental meditation that actually has been studied quite a bit and found to be quite effective. There are two sets of data on the research, and there are different sets of outcomes and benefits and hazards involved in using hormones. In general, we try to start with a low dose and let the patient titrate up to a level that will produce a circulating estrogen level that's satisfactory for her response.
Now there are concerns with hormone therapy. What Dr. Morgan would like to point out is that there are three major concerns against the others.
First, breast cancer. Everybody's concerned about breast cancer. Second is heart attacks. That's serious. But the most common one that we really address all the time is estrogen. And there's been very little historical interest. Your question was, what are we doing now as opposed to 10 years ago? We really haven't changed much in our concept about blood clots. For that reason, our preference is to try to use the non-pill forms of estrogen as much as possible. The pills go through the liver and, simply put, can increase blood clotting chemicals and the risk of blood clotting.
Now the most common question for most women for Dr. Morgan is, how will I know what I'm going to be confronted with? Well, the good news, according to Dr. Meredith Morgan, is that menopause is controllable.
Basic message I'd like you to get is there are many ways to approach this. This is not going to be incapacitating. It's controllable. Maybe that control is the goal, but we're not going to have terminal hot flashes.
My name is Rashid M. Rashid. I have an MD and a PhD. I was born and raised in Puerto Rico. Went on to medical school at Loyola University. I did a combined degree program. I did an MD and a PhD at the same time. So it took me 7 years. Normally, if I had done them separately, it would have been a 10-year program. I've always had a very strong interest in research. I really like to understand where the information we use comes from, why we use the information we use, and why things are happening. I trained at MD Anderson, so when I did my training there, I had the opportunity to do rotations in clinics around the country, including at UCSF and other clinics that specialize in hair loss. So it always fascinated me to be in this area where few people were in, and where it really matters to people. It really matters to people that they're losing their hair. And yeah, we have over almost 70 peer-reviewed papers, all in journals that have very strict criteria for publications, including national journals like academy journals and our specialties in dermatology and medicine, trauma, across the board. Our hair loss papers mostly focused on things like other peripheral associations with hair loss, like vitamin D deficiency. We have a paper that is often cited about vitamin D deficiency and hair loss. We do a regular daily auditing of the peer-reviewed research, and we regularly review and examine what's out there. We consolidate that, we provide that in an updated blog we have online, and it basically summarizes all the main new research ideas that are coming into place, or they're just being developed by scientists and physicians around the world. So our method is called the follicular unit extraction. That's been around for a few years. It used to be done manually, hair by hair. It would take a long, long time. Now we have different devices and machines that have sped up the process, so we can do larger cases in less time, and the price is also more acceptable to people than it used to be. You would get more hairs, get back to work, and a lot less downtime. And the healing is very, very quick.
Everyone should have a complete physical every year. There are 4 important parts to a complete physical. There's the history. Your doctor will ask you about diseases that run in your family and diseases and problems that you may have had, including surgeries that you've had in the past. Then there's the physical exam. The physician will look in your ears and your throat, listen to your heart, check your thyroid gland, push on your stomach, check your reflexes, and check for moles and other problems that are important to find at an early stage. Then there's the lab work. We do a lot of lab tests during a complete physical, and the reason for that is to pick up everything from cancer to cholesterol. And then the 4th part, and this is the important part, the physician will tell you what is particularly important to you to stay healthy, based on your own history and physical and lab work, as well as just in general for the population. For example, should you be on vitamins? How much exercise should you get? What should your weight be? So stay healthy. Give yourself the gift of a complete physical.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com.
Probably for the better part of 10 years, when I would cough or sneeze, I would release urine.
The leaky bladder is extremely common, and I think one of the biggest issues is that women just don't like to talk about it. They think they have to put up with it, or they're somewhat reluctant to talk about it in the office to their doctor.
It finally got to the point where it was interfering with stuff. I had to carry extra underwear and clothes to work, or I'd have to go home in the middle of the day, and it was I don't think anyone ever noticed, but I felt embarrassed and uncomfortable, and that was what finally made me decide to get tested to see if my problem was due to the incontinence that this would fix.
The procedure now is also a minimally invasive procedure, and it involves placing a small piece of mesh underneath the urethra. That's the tube that goes from the bladder to the outside, and it forms just a hammock or sling underneath the urethra, and when placed correctly, it has an over 90% chance of success.
After I had it done, I told Dr. Leibman I wish I had done this 5 years ago, because it made that much of a difference. But I thought I was too young, and so I convinced myself, oh, you don't have this, it's something else. This isn't going to fix your problem, and so I just didn't ever talk to him about it. So I should have talked to him sooner.
The recovery is also just wonderful. It's done as an outpatient. This procedure is still done as an outpatient in a outpatient facility or freestanding outpatient clinic, and the patient will go home, again, have something to eat, maybe take some pain medicine, but very little discomfort associated with it.
I sneezed, nothing, not a single drop, and it's been 2 years now. I mean, it's completely changed my life.
Very little discomfort associated with it. And what's really nice about it is that it's effective immediately. If it's going to work, she'll tell you the next day she hasn't leaked, much to her surprise.
Well, Jim, that'll do it. That'll wrap up another edition of the Best Docs Network, featuring some of the best physicians in the Houston area that are changing people's lives.
And of course, for more information on all the outstanding doctors you see on today's program, another place to find them, bestdocsnetwork.com. That's bestdocsnetwork.com to find the right doctor.
And don't forget, if you have a question or comment, we want to hear from you. Send us an email at info@bestdocsnetwork.com.
All right, that'll do it. So long, everyone. We will see you next week.